Welcome, everyone, and thank you for taking the time out of your busy day to join us. My name is Kayla Zamri, and I'm the Senior Marketing Manager here at Binary Fountain. I'll be moderating today's webinar. We know it's been a challenging and hectic time in everyone's business and personal lives, so we'll move through quickly and squeeze in as much actionable insight as we can today. For the next 20 minutes, we'll discuss our findings about the online conversation surrounding COVID-19 and answer any questions you have about managing your brand reputation through the crisis. I'm joined by two of my colleagues at Binary Fountain, Shruti Mehta, our Solutions Engineer, and Bridget Cardell, our Senior Account Director. Just as a side note, we're all working from home, and I'm sure most of you are too, so hopefully we won't have any background noises, but I'm sure we're all in the same boat. But we'll get started, so let's go to the agenda. Before we begin, we'll look at what to expect today. First, we'll look at data on the volume of online reviews and brand mentions regarding COVID-19 and which platform consumers are using for information. Then we'll dive into what patients, consumers, and caregivers are saying online and how healthcare organizations can respond. Then we'll offer some quick tips on ensuring your local listings and reputation management programs can navigate this health crisis. And finally, we'll have a Q&A session at the end. After we're finished, we'll take a few questions from attendees, but please feel free to submit those at any time during the webinar. At the bottom of your screen, you'll see a Q&A tab, and you can go ahead and submit anything you'd like Shruti or Bridget to address. Now I'll pass things over to Bridget and Shruti. Welcome.
Thanks, Kayla. So the big question on everyone's mind right now are, where are consumers primarily getting their information related to COVID-19? I'm sure we don't have to tell you all that people have been directly contacting their healthcare providers for more information, but we found that they actually are doing so less frequently than checking online sources. So to get ahead of this, we recommend that you anticipate the questions that you may get or that you have been getting and posting those answers on social media, any other landing pages for your organization, as well as other online directories. Important to note is one of the main sources for information and reviews is Google, and the usage of Google My Business has been up worldwide, with every business scrambling to include different updates, hours, addresses, temporary closures, and this has led to problems and delays with new listings updates, such as hour updates, address updates, etc. So you should still update your listings as normal, but be prepared for any potential delays, since there are so many other folks that are doing the same type of work on Google's side. In response to the influx of COVID-19 related reviews and comments, some platforms have been making changes to their site, which Binary Fountain has been monitoring to keep you all informed. For starters, Google and Yelp have made what appear to be temporary changes. On the Google side, Google has suspended some service due to staff shortages on their side. It's temporarily disabled local reviews on Google My Business and disabled Google Q&A. New reviews and questions that customers post on a company's GMB listing will not appear on the listing at this time. On the other end, Yelp has changed its review guidelines to protect local businesses from reputational harm. So it's working to delete any claims that people contracted coronavirus from that business and offering free web page upgrades and support to some affected businesses. We at Binary have a resources page on our website that you can check for these updates on these platforms in real time. We stay up to date on these developments concerning listings and reviews to keep you all informed on how they may impact your marketing efforts. Now that we've talked about where consumers are getting their information, we want to talk about which platforms are seeing the most comments and reviews related to the virus. When we look at the mentions exclusively from the Binary Fountain platform tracked via our clients, we can see that Twitter is by far and away the biggest source of feedback and conversation online. This is partly due to organizations using that as a mechanism of doing any real-time updates, being able to provide real-time tweets with new information as they're getting it, but it's also a way for consumers and patients to engage with health organizations to actually have a conversation about questions or any updates on their end. The second big source here is Facebook. Facebook is a means for both patients, visitors, and organizations to provide questions and updates. So with that, we've seen a larger uptick in both Facebook comments, Facebook reviews, and visitor posts that are addressing questions on COVID-19. Other sites like Healthgrades and Vitals, third-party sites, are seeing some of feedback here, but not quite as much as some of these other sites. It is important, though, to monitor all sites, whether they be social media, third-party, or your own landing pages. So we encourage you to take a look at each of those to monitor exactly where your specific feedback is coming from. One thing to note is that we have noticed that Google has less comments and reviews related to COVID-19. Part of this has to do with Google disabling the Google Q&A and the reviews. So it is a good opportunity for you to utilize some of those other social media platforms to track the conversation. With all of this information floating around on social media, we have seen a usage increase on the binary platform. We have seen in the past 60 days that there has been a 43% increase in users monitoring reviews on our platform, both on the health analytics side and the social listening side. In the same time frame, there have been a 62% increase in users actually responding back to consumers. So with that increase in reviews and questions, we have an increase in the responses and engagement that we have with our consumers, and also an increased onus to respond to those consumers knowing this is a sensitive topic. In that same vein, we've seen an 84% increase in the time spent on engagement per user. This is a sensitive topic for people, and because of the uncertain times, we want to make sure, and clients want to make sure, that they are thinking through and being thoughtful about the exact response that they have that's going back to patients. Healthcare organizations that are using the social listening tool from Binary Fountain have been mentioned alongside the coronavirus in thousands of Facebook comments and posts on their business profiles, along with getting mentioned via Twitter as well. The takeaway here is focus on disseminating the information across multiple platforms. Don't rely on the previously popular pages like Google, as there's a couple changes that are happening that may actually affect your ability to get the information and address patient and consumer concerns. Utilize everything from Facebook to third-party directories, tweets, your landing pages, because that is where we see consumers are most getting their information, and it's the easiest way to get the most amount of information out to as many consumers as possible. I'm going to pass it over to Shruti to talk a little bit about the conversation online regarding the topics of coronavirus.
Thank you, Bridget. So now that we know where the majority of the volume of comments are coming from, let's try to understand what people are saying about the coronavirus. What we're doing, or what we're seeing from Binary Fountain's clients and across the board, is that major concern for people are physical health of their family, access to food, access to health services, personal finance, and employment. And further down the list, but still important to look out for, are comments about mental and emotional health of the family following containment guidelines, as well as physical and mental health unrelated to the coronavirus. As far as the Binary Fountain data goes, most of these conversations are online. Less than 1% of them are through surveys. As most news focus of social media giants goes, like Twitter, topics related to coronavirus more frequently involve notifications about new cases, community updates for healthcare providers, and links to informational content. The most common Facebook mention of the virus includes questions about providers' preparedness, reviews about their handling of flu-like symptoms and treatments, and concerns about process changes brought on by facilities' preventative measures, such as closures or reschedules. Revive Health Study, who has provided us with tremendous information that's really valuable, talks about almost everyone is getting their information from TV more than once a week. Following that is social media and other websites, where about 50% of the people are looking at it several times a day, and close to them are looking at it, almost 75% of them are looking at it on a daily, regular basis. I'm going to hand it back to Bridget.
Perfect. Thanks, Shruti. So we want to talk a little bit about what consumers want to hear from healthcare providers and how often. So we have seen that consumers would like to receive information from their local health system on topics like updates on COVID-19 in their community, information on testing criteria and locations, information on how to access services during the pandemic, and also personal health and wellness information, things like social distancing, sheltering in place, information on cost of the testing and treatment. We've been reading up on the Revive Health survey, and it's been really valuable for us in pulling some of these key statistics. One of the statistics is that 65% don't feel they have enough information on how to get tested. And on the other end, only 30% know where to go and have received information. So the best way for us to address these types of questions and concerns is to manage this information and get ahead of the questions and post answers and links to your website, your social media pages, and any other listings. These types of updates will want to include information that is global, such as updates from the CDC and WHO, but also information on local updates. Everything that we've seen so far can vary state by state, and so you want to make sure you're keeping your consumers up to date on both the local updates as well as the national and global updates as well. We want to recognize that email has been a very big part of reaching out and giving more information about strategy and next steps to consumers. We've all probably seen that many organizations are emailing you out, giving you updates about how that organization is specifically handling COVID-19. With that said, that makes the saturation of that market and that communication type, it's difficult, it's saturated. It's something that could potentially cause your email with important information to get lost in the shuffle. So we know that that may be an important piece of your strategy. We do want to recognize and encourage you to use other forms outside of just email to make sure that you are addressing as many questions as you can get and reaching as far as you possibly can across various mediums. The next question that we have is, how should I shape and adjust my marketing communication strategy? So this is probably one of the big reasons that you all are here on the webinar. We recommend that you use a combination of social media, your own website landing page, and Google posts to engage consumers in short, frequent communications. On the Google side, like I said, there may be some delays in updating things on hours and addresses, but this is an opportunity for you to leverage things like the description on those pages or other areas where you can update on your page to give pertinent information about your organization, next steps, and anything relevant to what a consumer may need to know before potentially either calling or visiting a particular office. Another thing to recognize is we want to humanize your business operations and make it clear to the consumer that, you know, we're all dealing with the same thing. We want to make sure we are giving them clear and concise advice about what to do and what the next steps are, but also being compassionate in our responses, recognizing that we are responsible for the providers and caregivers' health and also the public health as well. I'm sure you all have noticed that you are going to receive negative social media reviews in general, but there is a potential sensitivity towards more negative reviews during this time. I mentioned before that Yelp is doing everything in its power to make sure that those types of reviews are not going to tarnish your online reputation, but you do want to make sure you're prepared to address those types of negative comments if they do come onto your review sites or your location sites. We recommend that you stay consistent with your messaging across all social media platforms, and remember that you want to pack your review responses with content that is very clear, it's concise, and it allows them to understand what they need to do moving forward. That may include including links, it may include phone numbers or email addresses, anything of that sort that would be helpful. So on this right-hand side, we actually do have a response by a healthcare organization to a sensitive patient who is concerned about her delivery in a few days or weeks. You can see in the response, the person was very short and concise in what they delivered in their message, but also provided a link where someone can get more information and can dig a little bit further into what's relevant to her, but also recognizes that that person may need to contact their healthcare provider for more information that may be more specific to them. So a really good example of a way to keep your information concise, but also recognize that someone may not get what they need via that link and may require additional follow-up. For engaging your consumers on these types of reviews, we want you all to publish the content that you can on Twitter that includes updates, that includes any changes, responses to patients. Use the platforms that will get you to the widest audience and help think through how any of these social media changes, such as those going on in Google and Yelp, may affect your patient's ability to leave reviews on different sites. So if you are encouraging folks to leave reviews on sites, we are encouraging our clients to move their review generation to sites like HealthGrades or Facebook for the time being, since we know that sites like Google and Yelp may have those temporary changes that we're working through. This leads us into our next question of the best ways for healthcare organizations to respond to the online conversation. So I'm sure you all have a comprehensive review strategy that you all focus on when addressing patients in general, regardless of the time that we are in. If you do not have one in place, we recommend coming up with a consistent and corporate brand strategy so that it's very clear of the message across all platforms, especially if you are a larger organization. If you do have a strategy, you can merely adjust your response techniques as needed, and just remember that you want to respond calmly, compassionately, and transparently, during the COVID-19 epidemic. So this will include arming your teams that may be responding with corporate approved templatized responses where they can quickly respond back to a review or a question, but they also will have a script that allows them to adjust to circumstances, understanding that there may be some flexibility that they need to answer with depending on the question. Another thing to keep in mind on the healthcare side is healthcare is already sensitive in its reviews and protection of patient confidentiality and PHI. So we want to make sure that you all have a strategy as well to take that conversation offline. Two strategies that we have seen work well and would work well in this instance as well. First is providing an email address on that review response where someone can follow up directly with someone and be able to have their questions answered without answering all of those questions on an online setting. The second is sites like Yelp offer the opportunity to respond privately to the person that reviewed without posting an actual public response. So those are two ways that you can keep in mind that this is sensitive information. We want to be extra cautious of patient sensitivity and patient confidentiality right now. So those are two strategies that we have kept in mind. The last thing that I will say is that it's very important, as we've mentioned before, you want to keep your content global and give the right amount of information, but keep in mind a lot of people are looking for local updates. They want to know what's happening in their area, in their community, and if they did have an issue, they want to have a clear direction on what they should do before they contact their healthcare provider, before they go to a healthcare provider, or they maybe seek out testing. So be sure to include both global and local updates in any type of communications that you're including so that it's relevant to the specific audience that you may be dealing with. I will pass it over from here to Shruti on specific changes to listings and local landing pages online.
Thanks, Bridget. So with the times changing and a lot of businesses or organizations being impacted, we want to be able to inform you guys on what the best ideas or solutions are when you want to make updates to your listings and local pages. So if you need to close locations or temporarily suspend specific services or make other changes, you should be able to update your facility's listing data as soon as possible. This includes hours of operation, services like coronavirus testing, contact info for different departments, divisions, and services, and editing your business description to include COVID-19 capabilities. For healthcare organizations, make sure to update your physical profile pages and website landing pages to make sure searchers are aware of your provider specialties, services, and their hours of operation. With all of your listings, make sure that searchers know exactly how your businesses or business operations are changing due to the coronavirus. Lots of brands we're working with are leveraging special hours. So instead of temporary closures, we can actually change those day to day. No matter how you do it, make it very clear that hours, facilities, services might have some changes as well. Schema just came out with new schema types specific to COVID-19. So talk to your website manager and consider getting that on your pages as well. The next question that we tend to look at are how can you leverage Google My Business or Google Maps to inform your customers about the most relevant and up-to-date information. Google has implemented COVID-19 type Google posts, which will appear more prominently on your business page, allowing customers to make easily understandable the current status of your business and how you operate during these times. Since Google has suspended reviews and Q&A, we recommend prioritizing other sites such as Facebook, Healthgrades, and Yelp for review responses, while those delays persist. At the same time, Google will prioritize its internal review of new listings, claims, and verifications for critical health-related businesses. As Google noted, while we prioritize these critical services, please expect a delay for publication of new listings, claims, and verifications for other types of businesses to Google Search and Maps. Google has also announced that organizations will be able to mark themselves temporarily closed on their GMB listings. So when we are recommending that our clients consider that option and decide on the best way to update the facility's hours on an ongoing basis. Update your services and amenities tab as well on your GMB page, both with coronavirus-specific services and other services that are available to patients. Update business descriptions as well to mention coronavirus-related capabilities.
Thank you, Shruti. That was super helpful, and I know we're a couple of minutes past, but we do have a couple questions if you're all able to stay on that I think would be really valuable for the audience, so we'll get to those quickly. This one's for you, Bridget. Is it better to use Google's new temporary close feature or to manually change that days/hours on those listings?
Yeah, so as Shruti mentioned, it is up to your business of what you ultimately decide. A couple of things to keep in mind, though, is the temporary closure feature is great, but can only be done by manually going and actually doing that location by location. So that is going to require more manual work. and isn't ideal, especially in the environment where we're not totally sure how long things are going to be closed. Typically, we have been recommending that our clients and others use the special hours functionality because, as Shruti mentioned, it can be updated day by day. It will potentially allow you to do bulk uploads or make those changes via API and not require you to go in individually and change things on an ad hoc basis. So again, it's up to you all in terms of what you decide, but we have seen, especially with the current environment and things being uncertain, that the most efficient way for you to manage the business is for you to utilize the special hours functionality and include more information in your business descriptions when you're providing updates to consumers.
That's great. Thank you, Bridget. I have another one for you. Do you have any examples of any brands, organizations that you're working with that have a really successful strategy in place right now for their crisis communication?
Sure. So not sure if anybody from Northwell Health is on the line, but Northwell Health, in our opinion, has done a really great job in their crisis management during COVID-19. They have on their website a digital resource center. So if you go to their website, there is a pop-up at the top that says to click here for more information on COVID-19. And it's an entire digital resource center, including information like frequently asked questions, prevention techniques, how to actually cope, knowing this is a really difficult time for everybody and it's very uncertain. So a lot of really good resources there, but it also allows you to ask a question on that website as well. So you can ask questions about what are the symptoms, what would be my next steps. So you can kind of engage a little bit more with their site, so you can get the information that you need all in one place, but you also have the option to ask a customized question and be able to get an answer in a more specific way. So I know a couple other brands and other organizations have something very similar. So as we mentioned, having all of that information on one place so that people can find it, in addition to a strong social media and online strategy, is really helpful for consumers and patients alike.
Awesome. Thank you, Bridget. One last question for you, Shruti. Do you recommend publishing listings updates to multiple locations simultaneously, or should you update them individually?
Good question. And it really depends on what kind of update you're looking to push out to your listing. So for example, for temporary closures, we know that that's done manual. There's no way to be able to do those in bulk. But for things like descriptions, hours of operation, you can make those changes in bulk, or you can do that directly through the API.
Awesome. Thank you, Shruti. That's all we have today. So I'll be sending this recording shortly after, as well as some links to some resources, including our site. We're continually monitoring all these third-party platforms to provide you all with the information about any of these changes that might be impacting your daily marketing activities. So we'll be sending that shortly, and we really appreciate you taking the time to join today's webinar. Have a great day.